Have you ever looked in the mirror and pulled in your waist and thought, "Ugh, what if it could just stay that way?" Today, Dr. Frank Agullo is going to walk us through the procedures that are changing what is possible for a snatched waist and a true hourglass figure. And stay with us because at the end, he's going to share the complete program he would recommend if you wanted maximum results. Every procedure in the right order, working together. But first, we have to understand three things: rib remodeling, the corset, and body contouring. In rib remodeling, most patients focus on the ribs. Dr. Agullo is going to tell us what the single most important factor that has nothing to do with the ribs themselves, and you can measure it before surgery. In the corset, you're going to learn the one thing that determines whether your rib remodeling results last. And in body contouring, Dr. Agullo is going to share one procedure you can add to rib remodeling to get results that most beauty seekers did not think were possible, and a couple more. Dr. Agullo, could you tell me about a patient or category of patients who they had significant challenges, could be male, could be female, with trying to get a snatched waist? How did they feel prior to working with you, and what were their issues?
Yeah, there's a section of patients, both female and male, that have a more male bony structure, and you see that there's really no waistline, and a lot of times they're thin. There's really no fat that we can remove to create a waistline, and it's really determined by their bony structure, their ribs and their pelvis, and it limits them from creating a waistline. So it's very frustrating. They exercise, they try waist trainers, and they just can't get the shape that they want. So rib remodeling has come along and changed that altogether.
Okay, I'm just thinking of Arnold Schwarzenegger, where he was critiquing bodybuilders back in the day. He said, "What is up with this bottle shape?" Back in the day, we used to, kind of really make sure that we had differentiation. But I know many women want that snatched waist as well. So let's dive in. Dr. Frank Aguillo trained at the Mayo Clinic in Rochester, here in Minnesota, and built Southwest Plastic Surgery in El Paso, Texas, into a practice that draws patients from across the country and around the world. Coming up, he's going to tell us about one measurement that tells you more about your rib remodeling outcome than anything else. Most patients have never heard about it. And stay with us all the way to the end because Dr. Aguillo is going to share the complete program he would design if someone wanted the most dramatic hourglass transformation possible. Dr. Agullo, welcome to Beauty Seek.
Thank you. I'm happy to be here.
Great. We're happy to have you. Most people assume these days that to get a smaller waist, that rib remodeling means you need to remove a rib. On a scale of 1 to 10, how necessary is it today to actually remove a rib to get a significant hourglass shape?
That's a one. Really, that was the limitation before. We wouldn't do it because we thought that it was the risk really outweighed the benefits. The ribs, their function is to protect the organs that are inside. Um, and when you remove a rib, you lose that protection. Not only that, you risk having an injury to the lungs, like a pneumothorax, where you actually puncture the lung, or a contusion. You could have chronic pain from nerve injury, and the greatest downside is that you have to make a pretty large incision to remove a rib, and most patients want these procedures to be something that's not noticeable, so they don't really want that scarring.
Okay, so now we've got a whole new procedure, a whole new technique and technology that's enabling us to not have to remove ribs to get a snatch waist. And most patients don't even know about it, correct?
Right. I mean, it's becoming more and more popularized in the media. It is getting attention, and we are getting a large volume of patients calling and asking about it. But I would say maybe less than 10 surgeons in the United States actually do this procedure. So it is pretty innovative, but it is available and it is very powerful.
Amazing 10 surgeons in the United States. That's amazing. Let's talk about safety because you shared how unsafe pulling out ribs were. But now you use a tool, ultrasound guidance, for the procedure. A scale of 1 to 10, how much does ultrasound guidance now increase the safety compared to not having ultrasound?
It's a 10. I mean, when you can do something and you can visualize it instead of doing it, with your eyes closed or blind, obviously everything improves. And we prove that with the BBLs, making them safer. So with the rib repositioning, we use the ultrasound not only to visualize where the ribs are and which ribs we want to target, but also to visualize where the nerves and arteries are. We can use this information to put a local anesthetic in that area to numb the whole area with a long lasting anesthesia like Exparel, which would last about 3 days and make the patient more comfortable. And of course, the most important thing, safe.
Amazing. Safety is key. How long have you been using ultrasound in this kind of a procedure?
I used it from the start. I mean, it's we've always used ultrasound for BBLs, and it was really easy to incorporate it into this procedure.
And you also use a device called a piezotome, which most patients have never heard of. And I feel like as a beauty seeker, it makes sense to be more informed about who's using, the most cutting edge technology and who's not and why not. I spoke with a doctor, Zachary in Canada, and she's using a piezotome to do scar-free rhinoplasty. So I was excited to hear that it was being used with rib remodeling. 1 to 10, how much has that tool, the piezotome, changed what's possible in terms of reduced scarring and recovery?
It's a 10. I mean, it's really the only way to do it without any scars. When we started doing this in the early stages, we were using saws like orthopedic surgeons use to cut bone. But the saws are larger, so you have to make a larger incision. I mean, we were talking about an inch, inch and a half, but it's still a scar. Just to be able to get that blade in to cut the rib. Then the pisiotome came along, and we were using a smaller saw head, uh, but it still required about a centimeter scar. But now we're using a needle tip that actually goes through we make a little puncture with a regular needle, a 16 gauge needle, and then through there we can bring in the pisiotome and do the entire procedure really scarless because after you get a shot you really don't see anything afterwards, right?
Yeah, it almost seems like science fiction, like a needle-sized saw that you're putting into the body to get a snatched waist.
Yeah, it definitely made the procedure a lot more accessible and scarless, which is what patients really want.
Exactly. So you used to use a saw, and then you've moved through the whole transition to using a piezotome.
Right, I was one of the early adopters of rib remodeling. I was really interested in it. I did see the power behind it and the logic, which we'll talk about it a little bit later. So yeah, it has been stepwise to a point where now it's a scarless procedure.
That's great. Okay. Before we move into some anatomy questions, how often are you performing this procedure?
It's pretty common. I would say we're doing maybe 3 or 4 cases a week. The more and more patients are interested in it. We do it in isolation, which means just the rib repositioning. But a lot of times we combine it with other procedures.
That's great to know. I think that's what I think patients want to hear is, is a surgeon who's doing it and learning multiple times a week. Love that. You mentioned something before the interview that I wanted to ask you about directly, the space between the iliac crust, which I want to learn more about. What is that? And the last rib. On a scale of 1 to 10, how much does that measurement between the iliac crust and the last rib determine what kind of hourglass result is possible?
So I wouldn't say that it determines what kind of hourglass result, but it does determine your limitations. So uh, the last rib and the top of your iliac crest, and you can feel that on the side. If you feel the top part of your pelvic bone, and then you go up along, and you'll feel that last floating rib, which actually ends pretty much there.
Yeah.
Those are your limits. That space that you have there is the only space we have to work with to create a waistline. unless we move one of those two structures, and that's where rib remodeling comes in. And we have a little diagram here where you can see exactly what I'm talking about. If you look here, you'll see that last rib and the pelvis. And that's the
Yeah.
only space really to where, when you stand in front of the mirror and you push that in, you can't push it past where that floating rib is. So that is your limitation. Now, if we move these two last ribs, now the space is bigger. You have the space from the iliac crest all the way to that 10th rib. So now we can make a lot more progress.
Okay, gotcha. So those are the ribs you're addressing. And once they move in, that contributes to that snatch waist.
Exactly.
Okay, we're going to have to go into the detail of that. Uh, if someone is sitting across from a surgeon discussing rib remodeling for the first time, what questions do you think that they should be asking that maybe you'd really never hear from them?
Um, I think the most important things is obviously somebody that has experience doing it. And the question I get the most is this going to hurt a lot? So some of the things that I do is we inject that longer lasting anesthesia, which makes a big difference. I think it's really important that your surgeon uses ultrasound to make it safer. And then really the most important thing is using the corset afterwards. So that waist trainer really has to be on there for about 3 months to really get the most out of your procedure. So those are all three really important things to consider. And in terms of pain, I mostly see that patients do very well with the procedure. It's I would say it's a mild to moderate pain that's very easy to control with the normal pain medications that we give, and it's not one of the top surgeries where you would say that it's going to be a severe, intense pain.
Great. So pain, days of pain after or hours after the anesthesia wears off?
I would say half my patients have no pain because we beat it before it even starts with that block, and then we just stay on top of it with around the clock ibuprofen to create pain. If you beat it from the early stages, you usually don't get it. But every patient's different, so I can't promise that everybody's going to be pain free. We do have an expression here at Southwest Plastic Surgery: "Say no to pain." So it is one of our biggest objectives.
I like that. And stay beautiful, I see is your
That's
other.
right.
I love that. Okay. Question. Do you find that male or females have more pain or irrelevant?
I think everybody's different, but
Oh,
I do think a lot of males are a little bit more sensitive in terms of pain. I think women are are built to tolerate more pain for some reason.
I feel that too. That's fantastic. Okay, beauty seekers, here is what we just learned that rib remodeling today to get a snatched waist does not mean removing a rib. It means repositioning it. And Dr. Agullo is going to share a little bit more about what that repositioning is and how he goes about it. Uses a device called a pisotome. We use ultrasound and then we use painkillers. But in terms of the procedure, Dr. Agullo, could you just talk about that a little bit?
Sure. So what we're doing, and the way this started is with the floating ribs, which are the last two ribs. Those they're called floating ribs because they're not attached to the front of the chest wall, so they're not attached to the sternum. They're floating, actually. And so what we do is we go through the back, uh, right past the paraspinal muscles, and we visualize the rib. If you imagine that my finger is a rib, uh, we visualize the rib. We bring in the pisiotome right on top of the rib, and we create little punctures on the surface of that rib so that later we can just push and reposition it. So it's like a green stick fracture. It's still attached and it's going to heal in that new position. Of course, we need to use that waist trainer to keep it in that position as it creates a callus and then heals. And we do that for the last two ribs. Now we're advancing this procedure to rib number 9 and number 10, which are the false ribs. Those are the ones that connect to the sternum, but they connect through a shared cartilage that we can divide. So if you look again on this image, the floating ribs are down here. And you see three ribs here that are connecting to this common cartilage. So we can divide this common cartilage here and then also divide the rib on the back and turning into a floating rib that we can reposition inwards.
Okay, fascinating. So you're not necessarily even cutting the full rib. You're just making little incisions and then the corset slowly remolds it. Or do you actually have to crack the rib at some point?
So it's we call it green stick. You know, when you have a stick that's a little bit soft and you're able to bend it, and it does kind of break on the surface, but it's still attached.
Yeah.
So we do place the rib where we want it to be, and then the waist trainer is going to help keep it in that position.
Okay, fascinating. Thank you for explaining this because it is kind of like this almost magical procedure. And I think beauty seekers would appreciate understanding this. I
Right.
love this.
And with this procedure, we actually want to avoid completely breaking it apart because then it's going to take a lot longer for it to heal back together.
Mm. Does that ever happen by accident? Like people have more brittle bones or?
It can happen. It can
Yeah.
happen. Yeah. And that's one of the things that ultrasound helps you to see exactly how much you've been able to cut on that surface and repositioning. And then obviously with experience, you learn that you really don't want to be too forceful. You want that to just kind of ease in. So if we've done with the cutting and then we're trying to reposition and it's not quite going there, instead of using more brute force, we go back, cut a little bit more until it just folds into place.
So this is just kind of nudging and no force is really necessary.
Right.
Okay. Thank you, Dr. Agullo. You just showed us that the most important conversation in rib remodeling happens before anyone picks up a tool. And also, we appreciate you bringing this technology. How long has this technology been around?
I would say, it's been done for about 3 years. It's really been perfected over the last year and a half to the point that now it's a scarless procedure, I think, for the last year.
Amazing. Okay, we're going to move on to the critical treatment that needs to happen after the procedure, which you've already alluded to. But first, thank you for being here. Dr. Agullo, after rib remodeling surgery, a patient goes home wearing something for 3 months. How important is it that they actually wear it, and what happens if they don't?
It's the most important part about recovery. If you're not really good about wearing the waist trainer, or you think you're not going to be able to, then it's really a worthless procedure because the ribs are always being pushed by the internal organs to try to go back to where they were. So the waist trainer is going to help mold that until the ribs actually heal into that new position. So patients that do a really good job about it uh, actually see improved results through those 3 months. They'll actually get tighter on their waist trainers, and most of them actually call to get a size down towards the end of their 3 months.
Really?
Yes.
Okay, so there might be multiple waist trainers that they need to purchase, invest in, and get resized because their waist is getting so snatched.
Right, and it's really important that the waist trainer is appropriate to their measurements. Some people have long torsos, some people have short torsos. Everybody has different sizes, so we do have customized waist trainers available for our patients. And a lot of times, like I said, they do have to downsize as the waist gets smaller and smaller, and the swelling goes down.
Amazing. Okay, I want to dive into corset technology, but first, Dr. Agullo has been voted best plastic surgeon in El Paso for 6 consecutive years. And about 80% of his patients travel from out of town specifically for the procedures he's pioneered. Coming up, he's going to tell us about shapewear like a corset and how important it is and the details of what helps with the success of a rib remodeling surgery. And stay with us all the way to the end because Dr. Agullo is going to share the complete program that combines numerous procedures for a super snatched waist. I would assume that most compression garments might be made in standard sizes. How important is it that the corset be made specifically for a patient's measurements?
It's important because it is what's going to give us the result. And there's a lot of variability in patients. Some patients have long torsos, some patients have short torsos. If you have the wrong size, it may be uncomfortable. You have to wear it for 3 months, so it should be comfortable, it should be sturdy, and it should be strong to support that reduction in the waistline.
Okay, so let's talk about maybe the corsets that you offer and how you make sure that they're sized appropriately. I'd like to learn a little bit more about that because if I ever get a corset, I want to make sure it fits appropriately.
Right. So ours are ready to wear, but they come in all the different sizes. And we have them specifically here for our patients, or anybody that's interested in it can purchase it as well. So it does have, you can see the shape of it. The most important thing is that it's reinforced. So every one of these lines is actually a plastic uh, support system or cylinder. You can see that it does have multiple areas where the seam is done to create the waistline. And of course, it has the progressive clips in the front where you can make it tighter and tighter. So I think this, for example, you can see that this is kind of a long torso, whereas some would have a shorter torso. We really don't want to go up into the breast and compress the breast, of course. So that would be quite uncomfortable for 3 months.
Okay, so how low below the breast should the corset come up?
It should sit just under, maybe an inch to give it space so that it's not digging in, uh, and it should go all the way just above that iliac crest, so that it is compressing all the way down.
Okay, gotcha. And then I saw the hooks, so you can make it smaller and smaller. What was that? About a half inch in between each one,
Yeah,
or?
they're actually almost an inch in between.
Oh,
So
okay.
yeah, it is. And patients usually start on this very first one. They'll progress as the swelling goes down and the healing. They'll progress to the second one, the third one, and then we would size down.
So how do they know? Do they just feel the corset feels looser, or are they in contact with you? Should I move the adjust? Should I adjust it now?
Yeah, that we kind of train them and let them know when it starts feeling loose. We always want to get as the tightest possible. So they're attempting to do that every day, but sometimes it just doesn't give, and we stay in the same setting. But yeah, the more we progress, and actually, if it can be quicker, we move on. We don't really give it time.
Okay. And are these like the corsets back in the day where you needed a fainting couch, where you feel faint, or it?
So we're not pushing the limits on it. We're really just trying to move those ribs and keep them in place. So uh, we really haven't seen any problems with that.
Okay, so this isn't get it as tight as it can. It's get it just so the ribs keep moving.
Exactly.
Okay, perfect. As the swelling reduces over the 3 months, is the corset still actively changing the result, or is it kind of simply just holding things in place?
But towards the end, it's just holding things in place.
Okay, okay. Uh, so scale of 1 to 10, how important is the corset to get the results that you want?
It's a 10. I mean, it's really the most important thing after the actual procedure.
Okay, great. Uh, and then permanent results, 1 to 10. Even if you wear a corset, how permanent are these rib remodeling results? 1 to 10.
10. I mean, these are permanent. Once the rib heals in the new position, it's going to stay there.
Okay, great. So there's no risk once the corset comes off that things are going to go back to normal or back to
Right.
where
I
they were.
mean, the only thing that could change is obviously weight management. We want the patient to stay at their weight. If they increase weight, that does put force on the ribs. But other than that, a good healthy weight maintenance will keep the results permanent.
Okay, that makes sense. So when you're consulting with a rib remodeling candidate, what are you evaluating? What questions are you asking to determine are they a good candidate or not?
Uh, I would say almost everybody's a good candidate because if what they're looking at is creating a smaller waist. Now, I do want to see a patient that is within normal weight to get the maximum result. If they're a little bit overweight or obese, they should know that the results we're going to get are going to be less. Uh, uh, you know less evident because obviously the other issues are hiding things as well. Uh, I do evaluate to see how much fat is in the waistline area because sometimes we need to reduce that at the same time. We need to look at if the patient's had babies or has lost a lot of weight, their abdominal muscles may be weak or stretched out, and that also is going to affect the waistline. So there are patients that would need a tummy tuck at the same time. There's patients that would need liposuction at the same time. And the rib repositioning together with those would be the most effective. So that's the most important issue with rib repositioning. Now, most of the patients I see that come in are pretty athletic and they're in good shape. So we can do just an isolated rib repositioning.
Really? Okay.
Yes,
Okay, fantastic. So they already look lean. They're just I look more like a bottle and I want to look snatched.
exactly. Yeah, they're. I see a lot of bikini models, the ones that compete athletic. They get a little bit more muscle, so they're more up and down rather than waistline, and this helps them. I see also a lot of patients that have had other procedures before. They've already had the liposuction or the tummy tuck and BBLs, and they just want a little bit more results. So those can also be isolated patients for rib repositioning.
Okay, great. Yes, you're so right. Like that APEC is so pretty on a woman, I think. But if it could be a little more snatched, oh gosh, that would be just delightful.
Right. And I think there's a tendency between you know, I guess they call them bikini models because they're not fully bodybuilders. So they have more of that feminine outline. So the waist is something they're looking for as well.
I love that, a little softer look.
Right.
Okay, great. Beauty seekers, here is what you just learned. The corset is not really recovery wear. It's a critical part of the rib remodeling procedure, working from the outside while your ribs heal from the inside. And it should fit your measurements. Without it, your snatched waist is simply not going to materialize. Dr. Agullo, you just reframed the corset entirely for me. It's not just recovery, is what I learned, but it's part of the procedure itself.
Yeah. Essential part of the procedure.
Essential. Good
And
word.
and a little bit later, you're going to learn about an internal corset that I often do for some patients.
Dr. Agullo, on a scale of 1 to 10, how much more dramatic is the hourglass transformation when you add a complementary procedure?
Oh, it's a 10. I think the more you can mold and shape the waistline uh, with different procedures, the more dramatic result you can get.
Okay, great. And you talked in our last episode about an internal corset. Can you share more about that?
Yeah, so uh, it has to do with a tummy tuck, but it can be a mini tummy tuck. And what we're doing is we're bringing the muscles in, just like a corset does on the outside, but we're doing it on the inside with sutures, putting the rectus muscles together and then the oblique muscles together. So I'm one of the very few surgeons that will do a triple plication with a tummy tuck. And the reason I do it is because if you look at a traditional waist trainer, there's not just one seam creating the waistline. There's multiple seams, right?
Right.
So I imagine when we do a tummy tuck, if I only do the middle, we're not really getting the 100%. if we start bringing in those sides as well, then we're imitating an internal corset, which is actually going to be permanent.
Okay, because the muscles with women who've had children can separate vertically. Am I saying that correctly?
Yeah, they get longer, but they also separate horizontally or wide, and that's why you see a little bit of a remnant of a pregnancy where they have the that belly bulge in the bottom. Sometimes it's on the top. Uh, when I repair that, a lot of times I see the bulge on the obliques as well. Because those have been stretched as well. So that's why I bring the obliques in and create that internal corset.
Okay. And there's really nothing naturally exercise wise, et cetera, that would stitch those muscles back together. Is that correct?
It's correct because the we say the muscle has been stretched, but it's not really the muscle; it's the fascia, that hard covering around the muscle. So you can make the muscle stronger, but that fascia has been stretched, and that fascia doesn't respond to exercise. It won't contract. So the only way to make it tighter again is to actually plicate it and bring it in.
It's the fascia. Okay. I didn't understand that.
Yeah, if you see, if you look at a lot of my videos, I do a lot of social media and life surgeries. I will show you how the muscles separate in the middle. Uh, so the muscle bellies are intact, but they actually come apart from that thin fascia, and that fascia really is the only thing dividing what's in the inside of the abdomen and the outside, and that's why a lot of females get umbilical hernias after a pregnancy.
Amazing. Okay. We just kind of get ripped apart in order to bring children into this world. That's amazing, though, that there's a solution. I did not understand it was a fascia. I've always heard muscles separating, but that makes so much sense.
Right. It's the muscle separates, but because the fascia is getting stretched.
All right. Good to know. And good to know there's a solution. Dr. Agullo is also known as Dr. Worldwide. He was born in Puerto Rico, traveled around, and spread his training across the world. Now he's back in the United States, in Texas. He describes his patients as his community, not his clientele. And we love that here on Beauty Seek. That's the way we think of our community. Next, he's going to tell us the one thing most liposuction patients never hear from their surgeon, and it's the reason some results look sculpted and some look skeletal. And at the very end, he's going to share the complete program he would design for a patient who wants the most dramatic hourglass transformation possible. Let's dive in. We're going to talk about stacking procedures on top of a rib remodeling to get that really snatched look. Now, my friend had belly liposuction and it looked so bumpy and unnatural, almost like bunches of tissues below the skin. It just didn't look natural. On a scale of 1 to 10, how avoidable is the bumpy lipo result?
It's a 10.
Yes.
Under experienced hands, we know that we have to leave behind some fat. So that's crucial for a natural looking, feminine, or even in males. If we skeletonize that fat, what we get is a lot of fibrosis, bumpiness, irregularities, and it just doesn't look natural. I think part of a beautiful stomach is the areas that have a little bit of fat and gives the curviness. So
Yeah.
it is really important to preserve a healthy, even amount of fat throughout the abdomen.
Okay. So then would that sometimes be an additional procedure that you would perform at the same time of a rib remodeling to get, bigger results?
Yes. So anytime I'm looking at a rib remodeling patient, I do a pinch right where the waistline is, which is that space between the last rib and the iliac crest.
Okay.
If there's a pinch that's significant, we can always get it down to about this much. So if you're already about a half an inch in that area, then you may not get much out of it. But if it's any thicker than that, we can reduce that area, and that's pretty much how much your waist is going to go down on both sides. So it is significant.
Okay, so if I can pinch an inch, then I can get a little bit more of a snatch look from lipo.
Exactly.
Perfect. Okay, for someone then who is considering lipo alongside rib remodeling, what questions should they be asking their surgeon to make sure that they don't end up with the bumpy, lumpy lipo results?
I think the most important thing is to look at their before and afters. Make sure there's a lot of them, and and that on the sides we can be a little bit more aggressive in terms of removing fat. It's really in the front where we have to be a lot more careful because of that bumpiness, and then the surgeon should have a very laid out recovery plan, which includes the using the garments or the fajas. Of course, you're going to be using a waist trainer and also massaging. The lymphatic massages are crucial. They should be started on day 1 or day 2, and to get all that fluid out. Any fluid pockets that remain usually end up being fibrosis or that cobblestone appearance. So it is really important to massage those out, and that's going to help get that nice silhouette. I usually recommend 2 or 3 per week for at least 4 weeks, and it's like the waist trainer. It's one of those things you have to do.
Amazing. That was the first interview we ever did on Beauty Seek was about compression and lymphatic massage. And I sort of was like, really? Is this a thing? But I've been hearing it over and over from experienced surgeons like yourself. Like it's actually kind of critical.
Yeah, we actually have in-house certified massage therapists that treat our patients while they're here. A lot of them, as we said, are from out of town, so they get their first treatments here. We try to help them find somebody local, and our massage therapists coach them while they're here, so that they can coach the massage therapist close to their home later on.
That is so beautiful. And a lymphatic massage, could you even just kind of explain a little bit? Like, what is that like around the waist? Is it a deep tissue massage? Is it
It's
lightly?
It's a deep tissue massage, but the motions are towards our lymph nodes. So, in the abdominal area, it would go, the strokes go towards the inguinal nodes so that the body can clear that fluid. In some of my patients, I actually leave a drain when I do tummy tucks or when I do extensive liposuction on the abdomen, just so, because it's an easy exit site for those massages to try to get all that fluid out a lot quicker. Because, like I
Um,
said, the worst thing that can happen is that you have a pocket of fluid left and it turns into that thick fibrosis.
yeah. And maybe that's what my friend had. It was just, yeah, it sounds like it's well worth doing
That
the
that's what it
massage.
sounds like. And the other thing that I see is on thin patients that want to get the fat transfer to the buttock. The surgeons sometimes are too aggressive in the other areas just to get enough fat, and so they're only thinking about the volume in the buttock and not what the result's going to be in the abdomen, which I think is more important, really.
Okay, that's great. Okay, so you're alluding to another procedure that can be done to increase that ratio, that hourglass ratio. What else might you stack on top of a rib remodeling surgery?
Yeah, so we talked about liposuction. We talked about a way of cheating, which is adding fat to the hips. If we create a little bit wider hips, the waist all of a sudden looks smaller. So we have that ratio. And then the last one, which I do a lot on very masculine bodies, including male to female, is doing a mini tummy tuck, just to bring in those muscles and creating that internal waist trainer. So we make a small incision, almost like a C-section, very low, easy to hide with bikini or underwear. And we do a full elevation, just like a regular tummy tuck, all the way up to the chest, the where the ribs are. And I put those muscles together in the middle, which are the rectus, and then also bring the obliques in with those stitches. And that creates that waist trainer, which I call the triple plication internal corset.
Amazing. And
And
again,
when
go ahead.
and one of the things that I really like with this procedure, if you do it with the rib remodeling, is that you're doing the rib remodeling and then you're cinching those muscles. So you're really keeping the ribs in the position that you want. And then the waist trainer is just an extra layer of protection.
Exactly. Okay. So then would you take the waist trainer off once a day and do the lymphatic massage, or what's that protocol?
Yeah, you want to take a few breaks. You also want to make sure your skin's doing well. Most of the time, we recommend using a thin, comfortable t-shirt underneath, so that it's not marking your skin or damaging your skin in any way. So it is. You do take 3 or 4 breaks during the day.
Okay. Oh, really? Okay. So you take the corset off 3 or 4 times throughout the day.
Yes.
Okay. Okay, that's great to know. So you talked a little bit about fat transfer. Is that actually considered a BBL?
Yeah, so BBL is Brazilian butt lift, and there's really no lift in a Brazilian butt lift, but that's the name. It came up and it stuck, right? It is catchy. Uh, so really, BBL is any fat transfer in the buttock area. When I do a BBL, it includes the hips, the buttock, even the transition between the buttock and the thighs. So that's really important. But it can be isolated. Some patients have just the hip dips, and they have that guitar shape, and we just want to create just one curve. So we fill in just the hip dip area, and it can be very powerful.
Okay. So that hip dip area might need a good chunk of fat potentially. But what if you don't have an area on your body where you can harvest fat from without getting the lumpy bumpies?
Right. I tell most patients, if they haven't had lipo before, I can get a good amount. Even on we call them skinny BBLs.
Huh?
I can usually get at least 300 or 400 cc's of fat, which is great because the fat that you have is free. If we have to get a donor fat, the numbers go up pretty quickly. But yeah, we do have that backup. We can use alloclay, which is a donor fat. It's been irradiated so that there's almost no DNA in it. There's not going to be any foreign body reaction, and it's more of a structural graft. So it gives us the structure or the scaffold. We inject it in. We can do that under local anesthesia in the office. It doesn't require general anesthesia, and your own cells are going to move in and create that new fat.
Your own cells will move over that alloclase scaffolding and turn into fat, or what?
Yes,
Really?
yes,
Okay.
because the alloclay itself is really an empty fat cell. It has the structure, but it's not a living fat cell. Uh, but as we see the histology and we look at it under the microscope, after 3 months or so, it's like natural fat, and it's your own fat.
Really?
Yes.
Okay. How long have you been using the alloclay for patients who are just too skinny for fat harvesting?
So we've been using it for about 2 years now. We were one of the early adopters, and worked with the company in the early launch period. The results have been fantastic. When we inject fat, we always know that we're going to lose some of that volume, so we always over inject when we're doing a BBL. With alloclay, we see that what we inject stays. It really doesn't go down. So you get that volume almost in every case. And then about 6 weeks later, we even see it fluff out a little and give you a little extra. And I think that's why that happens, because your cells are moving in.
Amazing. Okay, that sounds like amazing technology.
Yeah, it's very predictable, which is nice.
Fantastic. Okay, I actually did speak with Carol Van Hoon out of Alaclay,
Oh
and
yes,
yeah, and she's amazing. She knows her stuff, but it's
right.
really great to hear the surgeons syncing with what they're saying this technology is all about. Sounds amazing.
It is. It's the future, and we're starting to see it in other applications, even for the face with lipoderma, and in the future dermaclay.
Okay, and so donor fat is from a deceased body, correct?
Correct.
Okay. And I think that initially it's almost like that sounds a little scary, but surgeons have been taking what cartilage out of deceased bodies for a long time, right?
Yes, so we've used cartilage. Orthopedic surgeons use it to recreate and reconstruct ligaments. In knee surgery. Uh, so it's something that's been around for a long time. In breast reconstruction, we've used dermis as a mesh to hold the implant in place. So it's something that's normal. And I really, when I explain it to patients, I really don't see any concerns. I think it's seen as normal now.
Okay. Just having been in this industry for quite some time, do you ever feel like the technology is moving so fast, like it's hard to keep up? Or no, I can keep up and it's a good pace and maybe we should even increase?
I think new technology is always welcome, as long as it's done safely, right? And we're sure that it's for the benefit of patients. So the faster it comes along, the better, and the it's always something good for patients.
Great. Okay, good. I'm glad to hear that. And I'm glad that you're on that edge teaching people like me. You mentioned before the interview that there is a skin tightening treatment. I'm just imagining that maybe if fat is being removed from a part of the body, that there might be a little saggy skin. Just guessing. But do you use any kind of skin tightening in part of this overall snatched waist vision and procedure?
Definitely. I do. I use a Renuvion J plasma routinely. We also use Body Tight, which both of them are radio frequency technologies that are going to create contraction, and is going to give us a smoother result.
Okay. And would you do that when the patient is still under, or would you kind of do that after everything's done and you come back and do some radio frequency?
No, so it's done at the same time. So when we do liposuction, we're first going to infiltrate the fluid, that's the anesthesia that keeps the bleeding down. Then we're going to use Vaser, which is the ultrasonic probe to break down the fat and the fibrosis. Next, we're going to put in the cannula to suction out the fat. And then the last step is to put in this probe that has the radio frequency to tighten everything up.
Oh, it's internal. I was thinking it was external.
Right. No, so this is internal. The Renuvion J plasma is internal. It has radio frequency and helium plasma. The Body Tight has an internal and external probe. That it's almost like an iron. So one goes under the skin and the other one's above, and we kind of iron out the area. And that's really works really well in the face and the arms and the thighs. For the body, I prefer the Renuvion J plasma. And we can always go on top of that and do some Morpheus 8, which is microneedling with radio frequency, and do a superficial treatment while the patient's asleep. And that's going to give us even more tightening.
Okay, this is amazing. This is this is fantastic. So if you really go full in, I want a snatched waist and I want to consider everything from, internal muscles, fascia, bone to saggy skin to moving fat around. Could you just take us through, gosh, if somebody wants to go all in, here are the steps that, you could consider as a beauty seeker.
Yeah, so I would say for like a mommy makeover, where we're starting to think also about a tummy tuck at the same time, it would be, and this would be the order that we would do it. We would do liposuction first, probably in the front of the body. Then we turn the patient, do liposuction on the back. We do the skin tightening, and of course, before the liposuction, we treat with Vaser. And then we do the fat transfer into the hip dips or the buttock or both. Then we're going to do the rib repositioning. And then we're going to turn the patient and finish with the tummy tuck and really snatch the waist with that internal corset.
Wow. And how long would a procedure like that be?
Usually, that if that's all we're doing, it's about 4.5 to 5 hours. General anesthesia, outpatient. Recovery for a tummy tuck is mostly because we're fixing those muscles. So it's like a hernia. It does take 2 weeks to get back to normal, easygoing activity, and 6 weeks to get back to the gym and heavy lifting.
Okay, really? So you could be getting some personal best RDLs and
Yes.
oh,
With
fantastic.
with the exception, if we're doing rib remodeling, then it is 3 months
Okay. So
for the exercise. Yeah.
no exercise for 3 months.
You can do some lower body. You can walk as much as you want. We just don't want a lot of forceful movements with the torso.
Okay, got it. Okay, that makes total sense. Oh my gosh, this is so great how the technology has improved. There's so many beauty seekers like me who, I'm getting procedures and taking care of myself and exploring what's next, but we really don't know what even exists. And what you've shared today is phenomenal. Thank you so much. Is there anything else that you'd want to share about to get ready for this type of a procedure? How can you be at, your healthiest so that, everything, kind of turns out great?
I think one of the most important things, and I really highlight this with patients, is coming in at a weight that you're comfortable at. So I don't really recommend uh, people that they gain weight so they have more fat, because then afterwards you have to stay at that weight and you may not be comfortable. uh, and then there's also patients that lose too much weight before the surgery to be at their fittest, but they're not going to be able to keep it up afterwards. So I want a patient to come in at a weight they're comfortable with, that is within the normal limits, and that they're going to be able to keep afterwards, because if you keep your weight afterwards, it is one of the key points in permanent result.
Hmm. Is that really subjective? Or are you really looking at based on your height and your bone structure, you should be within this weight range and you try to get them to commit to be in that weight range or
Well, ideally, the patient will have a BMI between 20 and 25. That's the BMI is calculated with weight and height, but sometimes that's not realistic. We have patients that are a little bit heavier, then they're happy with it and they're healthy, right? They're
yeah.
active, they're doing exercise, and that's fine. Uh, Obviously it moves the expectations, so we do have to put those in line with the patient's BMI. But also keep in mind that with a liposuction procedure or a tummy tuck procedure, you're going to lose between 5 and 10 pounds. So you do get that benefit as an add-on.
Okay, that's got to feel good. Anything else why would you not take a patient for this type of procedure?
I think the most important is if they don't have realistic expectations. So we know that moving those last two ribs is going to give us between 3 and 4 inches. If they're looking for more, then we really have to explore whether they're a candidate for the liposuction or also the triple plication. We can move to those other two ribs, 9 and 10, and move those, but we have to accept a little bit more risk. So usually I try to stay within the last two floating ribs. The other two ribs are an option, but the patient has to understand there's that risk of a puncture of the lung, which is significant. So
Yeah. No. And now you've got all the tools and the ultrasound and the pisotome. So, I mean, you're avoiding the risk, but once you move up in the ribs, the risk increases.
exactly.
Okay, that's great to know. Good. Thank you for your honest feedback. Thank you so much for giving your time to our Beauty Seek community. You are a gift to every beauty seeker who's ever wanted to understand what's truly possible when it comes to getting an hourglass figure. We appreciate your time.
Thank you. It was fun.
Absolutely. Beauty seekers, thank you for being part of our community that believes you deserve real education before you make serious investment decisions in procedures like rib remodeling. Every subscriber is how we keep bringing you surgeons like Dr. Agullo, who tells you based on their extensive experience, what beauty procedures that rank at a 10 versus a 1. So please subscribe if you find value in learning before you book an aesthetic procedure.
Give you up to 4 inches of shrinkage of your waist. That's a massive transformation in a very short period.
Most patients hear the words ribs surgery and picture something extreme, like a long recovery, ribs removed, weeks in bed. 1 to 10. How true is that narrative for you and your patients?
Oh gosh, I think that's about a one. People are really pleasantly surprised. There's no other option that's going to be able to give this type of transformation